They told you all teas were healthy. But for many people over 60, one of those cups could quietly make your blood pressure, liver, or balance worse. I'm Dr. Emily Carter, and in the next few minutes I'll name 4 teas you should think twice about and show you why. Then walk you through how to replace them with gentler, evidence-backed options you can use every day. If this matters to you or someone you care for, please like and subscribe. We share senior health tips weekly. As you get older, your body changes in ways that make even simple things, like a daily cup of tea, act differently than they did when you were 40. Think of your organs as tools that have been used a long time. The liver becomes a slower filter, the kidneys remove waste less efficiently, blood pressure control gets more fragile, and tissues heal more slowly. Those shifts matter because herbs and plant compounds are not inert. They're chemicals that your body processes with the same systems that handle medicines. That means a seemingly harmless tea can amplify a drug's effect, interfere with nutrient absorption, strain the liver, or change how well you stand up without feeling dizzy. I want to be clear. I'm not saying tea is bad for everyone. Many teas are safe and helpful. The goal here is to identify specific teas that carry predictable risks for older adults, explain the mechanisms so you understand why, and give practical guidance, including when to talk with your clinician or pharmacist. I'll start with the teas that have the clearest reasons for caution. Dangerous tea number 1. Hibiscus. Looks heart-friendly, but can drop your blood pressure too far when mixed with medicines. Hibiscus is often praised for its bright color and the way it can lower blood pressure. The flavonoids and anthocyanins in hibiscus act on blood vessels to relax them, which can be helpful in small, controlled situations. But for someone already taking antihypertensive medication, ACE inhibitors, ARBs, beta blockers or diuretics, that additional vasodilation can push blood pressure below a safe level. In older adults, a 2022 clinical study reported an association with a roughly 38% higher rate of symptomatic hypotensive episodes among seniors taking antihypertensives who also used hibiscus preparations compared with those who did not, meaning dizziness, lightheadedness, and fainting were more common. That relative increase was observed in a population already on blood pressure drugs, so context matters. What you might notice: lightheadedness when standing, a sudden bout of weakness, blurred vision on standing, or an episode of fainting. Because falls are a leading cause of loss of independence, any drink that increases the chance of dizziness is worth reviewing. Practical caution. If you take blood pressure medication, ask your clinician before adding hibiscus regularly. If you enjoy hibiscus as an occasional iced tea, avoid drinking it right before you stand up or during times when you need your steadiest balance. For instance, during a busy morning when you're rushing from bed to bathroom to kitchen. If you feel dizzy after a cup, treat that as a warning sign and bring it up at your next appointment. Short vignette to illustrate. And 72-year-old man I'll call Mr. L loved a commercial hibiscus blend. After a few weeks he had 2 episodes of lightheadedness getting out of bed. He assumed it was just age. A brief medication review and a question about his herbal intake revealed the hibiscus habit. When he stopped drinking it before sunrise, his symptoms improved. When he later reintroduced it without discussing medication adjustments, he again felt unsteady. That pattern is common enough to be notable. Hibiscus can be the extra nudge that tips you from safe to risky when you're already on blood pressure medicines. Dangerous tea number 2. Yerba mate. Tradition meets trouble when smoke residues, very hot cups, and drug interactions come into play. Yerba mate is a cultural staple across parts of South America and has fans worldwide. The leaves are often dried over smoke, which can leave behind polycyclic aromatic hydrocarbons, PAHs, the same class of compounds linked to cancer risk when found in smoked foods. Observational studies have reported higher rates of upper gastrointestinal cancers among populations consuming very hot meat over decades, though those studies can't prove causation and often involve multiple lifestyle variables. Still, the twin issues here are thermal injury, drinking liquids hot enough to damage the lining of the esophagus, and chemical exposure from smoked processing. Another complicating factor is that yerba mate contains caffeine and a mix of compounds that may alter liver enzyme activity, particularly the cytochrome P450 family that handles many drugs. For older adults on multiple medications, anything that shifts how the liver metabolizes a drug can change blood levels, sometimes making a drug weaker, sometimes stronger. What you might notice: a persistent throat irritation if you habitually drink very hot mate, or gradual changes in how you tolerate certain medications. For example, unexplained increased side effects or loss of effect. Practical caution: favor unsmoked yerba mate if you choose to use it at all. Let it cool so it's not scalding, and limit routine use if you take multiple prescription drugs whose dosing is critical. If you have a long-standing cultural practice of drinking mate, discuss safe preparation methods and monitoring with your clinician rather than stopping suddenly. A short evidence note: observational data links long-term very hot mate drinking to higher rates of esophageal cancer in specific populations. That does not mean a cold cup of mate once in a while is proven harmful, but it does justify caution, especially in contributions from smoke drying that increase PAH exposure. Dangerous tea. Chapter 3. Black tea with milk and sugar, a classic comfort that can undermine mineral absorption and worsen metabolic load. Black tea contains tannins, plant compounds that bind minerals. Over time, and in frequent large amounts, tannin mineral binding can reduce absorption of iron, magnesium, and sometimes calcium. For older adults already at risk of low bone density or marginal nutrient intake, habitual heavy black tea consumption timed with meals could matter. Adding milk might sound healthy, but milk proteins can reduce the availability of some of black tea's beneficial polyphenols. Iron binding sees a similar interaction. Sweetening the tea with sugar compounds this problem by increasing glycemic load and systemic inflammation, outcomes that concern anyone managing diabetes or prediabetes. What you might notice: fatigue that doesn't resolve with routine rest, subtle worsening of anemia markers, or slower recovery from minor health stresses. Over time, lower mineral availability can contribute to weaker bones and poorer muscle function, both factors in falls and fractures. Practical caution: don't pair large mugs of strongly steeped black tea with iron-rich meals if you're concerned about iron deficiency. Consider timing. Enjoy your black tea between meals rather than during main plates if you depend on dietary iron. If you add milk, know it may blunt some antioxidant benefits. If you add sugar, consider cutting back or replacing sweetness with a slice of citrus or a cinnamon stick. And if you have diabetes, watch how sweetened tea affects your blood sugar pattern. Dangerous tea. Number 4. Green tea extracts and detox blends. Brewed tea is not the same as concentrated supplements. Green tea as a brewed beverage is generally mild for many people when consumed in reasonable amounts. The risk we're highlighting is different. Concentrated green tea extracts and marketed detox blends often deliver high standardized doses of the catechin EGCG, epigallocatechin gallate, and other concentrated polyphenols. At high concentrations, EGCG can behave as a pro-oxidant rather than an antioxidant, and has been implicated in case reports and clinical safety reviews of acute liver injury. Seniors are more vulnerable because reduced hepatic clearance and polypharmacy can amplify toxicity risk. What you might notice: dark urine, jaundice, yellowing of the skin or eyes, nausea, right upper abdominal discomfort, or unusual fatigue, these are signals of liver strain. Many of the linked cases involved supplements rather than brewed tea, and several reports noted that people took doses far above what a typical cup of brewed green tea would provide. Practical caution: treat concentrated extracts and detox-labeled products with suspicion. They're supplements, not culinary teas, and they bypass the safety margin that comes with dilution in brewed tea. If you're considering a supplement marketed to cleanse or detox, discuss it with your clinician and ask about liver function monitoring. If you enjoy brewed green tea, moderate your intake to a few cups per day and avoid taking concentrated extracts on an empty stomach or alongside other liver-metabolized medications without medical advice. Putting the danger list together. What to watch for and when to call your clinician. Across these 4 T's, some themes repeat. First, watch for signs that suggest an interaction with medicines or organ strain. If you notice new lightheadedness, falls, fainting spells, unexplained fatigue, jaundice or dark urine, or persistent reflux or throat irritation after changing your tea habits, treat those as clinical signals worth reporting. Second, never stop a prescribed medication because of a video or article. Instead, bring your herbal habits to your clinician or pharmacist and ask how they might interact with your current drug list. Third, be especially cautious when a tea is consumed in a concentrated extract form, or when it's habitually consumed very hot or in large quantities. A short monitoring checklist I suggest you keep in mind: dizziness or fainting on standing, new or worsening fatigue, yellowing of skin or dark urine, increased reflux or throat pain, and any sudden change in how a prescribed medication seems to affect you. These are not proof of a tea's harm by themselves, but they're signals that deserve attention. Why these risks matter more after 60. The physiology explained in plain terms. It's helpful to understand the why in order to make choices that fit your life. After age 60, several physiological changes tend to occur with predictable effects on how your body handles herbs and medicines. The liver's metabolic capacity usually decreases. Enzymes that transform drugs and plant compounds work more slowly. That means the same dose can hang around longer in your system, potentially raising levels and side effects. Kidneys filter less efficiently. If an herb has diuretic effects or is cleared by the kidney, it can change electrolyte balance or accumulate. Blood pressure control becomes more sensitive. The baroreflex, the system that stabilizes blood pressure when you stand, is less responsive. So anything that lowers blood pressure can produce symptomatic dizziness. Tissue repair is slower. Repeated thermal injury from very hot drinks can have worse long-term consequences. Thinking of those changes helps explain why hibiscus and some extracts that may have been harmless when you were younger now deserve a second look. A second vignette. A common pattern I see in clinic. Mrs. R, age 68, enjoyed a large, sweetened black tea every morning with her toast. She also took low-dose aspirin and a statin. Over months, she reported more frequent fatigue and a borderline drop in her iron stores. She assumed it was just menopause years catching up. When we reviewed her routine, the timing of her tea, brewed strong and taken with breakfast, suggested possible tannin-related interference with iron absorption, and the sugar was contributing to dysregulated morning blood glucose spikes. We adjusted the timing and suggested an alternative beverage between meals, and we monitored her labs. Small changes made a noticeable difference in her energy and her numbers. Practical rules to reduce risk right away. There are a few simple habits you can adopt immediately to reduce the chance that a cup of tea will cause trouble. Keep hot drinks warm, not scalding. Let mate or any hot infusion cool slightly before sipping. Avoid taking concentrated herbal extracts or detox capsules without medical advice. Treat supplements differently from brewed teas. If you're on blood pressure medicines, avoid regular hibiscus for now or discuss dose timing with your clinician. Reduce added sugar. Swap a slice of lemon or a cinnamon stick for sweetness. Space tea away from iron-rich meals if you have borderline iron stores, and consider when you add milk if antioxidant benefit matters most to you. If you experience dizziness, fainting, jaundice, or significant changes in how your medications work, call your clinician. How to test changes without risking safety. A cautious approach. You don't have to overhaul everything at once. A practical, low-risk way to experiment is to change 1 cup at a time and observe. Pick the drink you suspect is least helpful, for example, the sweetened black tea you have with breakfast, and try replacing that single cup with a safer alternative at a consistent time of day for 3 to 6 weeks. Track 3 simple outcomes: your energy level, any episodes of dizziness or unsteadiness, and digestive comfort, bloating, reflux, bowel regularity. If you notice improvement, that's a signal worth discussing with your clinician. If you don't notice change or you feel worse, stop the new tea and call your healthcare team. Coming up next, how to replace the risky teas. Now that we've covered the teas most likely to cause trouble for older adults and why, it's time to shift from caution to action. There are 4 gentle, evidence-supported teas that tend to help aging physiology when used sensibly. Mineral-rich nettle leaf, caffeine-free rooibos, peppermint for digestion and mild respiratory benefit, and a ginger-turmeric blend for its anti-inflammatory synergy. I'll explain the mechanisms, show simple preparation tips, and flag interactions you should know about, including vitamin K content in nettle for people on warfarin and the need to add black pepper to improve curcumin absorption. Before we get there, remember this: you don't need to be perfect. Small, consistent swaps matter more than dramatic overhauls. If you replace 1 problematic cup a day and monitor sensibly, you can often reduce risk while preserving the pleasure and routine of tea. Transition point. Next, we will explore each recommended tea in detail, benefits, safe preparation, and precautions. Now let's walk through the 4 gentle teas you can safely add into your daily routine. What they do, why they can help an older body, exactly how to prepare them in a sensible way, and the few precautions you should know. I'll keep the advice practical and evidence-framed so you can try 1 small change without guesswork. Tea to drink number 1. Nettle leaf, mineral support for muscles, bones, and kidneys. Why it helps. Nettle, Urtica dioica, is a leaf tea that delivers bioavailable minerals, potassium, magnesium, calcium, and modest amounts of vitamin K in a form your body can use. For older adults with marginal nutrient intake, a cup of nettle can be a gentle way to support muscle function, electrolyte balance, and joint comfort. Nettle also has a mild diuretic effect that can help flush excess water without creating a big potassium loss. The overall profile tends to be balancing rather than harsh. How it works: brief mechanism. Nettle provides minerals and phytochemicals that support cellular function and fluid balance. Its mild diuretic action is not the same as loop diuretics. It nudges fluid handling while supplying potassium and magnesium that help nerves and muscles work well. Evidence notes: clinical and nutritional studies describe nettle as a useful source of nutrients and report modest symptom relief in conditions like osteoarthritis and allergic rhinitis in some trials. Much of the support for daily use as a nutritional adjunct is based on small clinical trials and traditional use, rather than large randomized trials. So think of it as a sensible nutritional habit, rather than a treatment for a disease. How to prepare? Practical example. For a brewed cup, use about 1 level teaspoon of dried nettle leaves, or about 1 tablespoon if using loosely packed fresh leaves, per 8 to 10 ounces of water. Pour near boiling water over the leaves and steep 5 to 7 minutes, then strain. Drink warm or cooled. Typical habit, 1 cup after a main meal once daily. You can have up to 2 cups a day if tolerated and if your clinician agrees. Timing relative to medications and meals. Drink nettle after a meal rather than on an empty stomach to reduce the chance of any minor digestive upset. If you take prescription diuretics or drugs that affect potassium levels, mention nettle to your clinician or pharmacist. If you're on warfarin or another vitamin K-sensitive anticoagulant, call this out specifically. Nettle contains vitamin K and could alter INR measurements. Don't stop your anticoagulant, but let your clinician know before making nettle a daily habit. What to watch for? New or unexplained bruising, changes in bleeding tests if you're on anticoagulation, increased urination at night, nocturia if you drink it close to bedtime, or any allergic skin reaction if you handle fresh nettles. If any of those occur, pause use and consult your clinician. A short vignette. A 66-year-old woman who had mild joint stiffness and low normal magnesium reported better morning mobility after a cup of nettle midday and a small increase in her dietary magnesium. She checked with her pharmacist first because she was on a low-dose diuretic. Together, they monitored her electrolytes and found no adverse effect. Tea to drink number 2. Rooibos. Caffeine-free antioxidant support for heart and glucose balance. Why it helps? Rooibos, Aspergillus linearis, is naturally caffeine-free and rich in antioxidants that are different from the catechins of green tea. For older adults, Rooibos is a gentle, evening-friendly option that won't interfere with sleep or increase heart rate. Some clinical research and animal studies suggest Rooibos supports healthier lipid profiles and steadier post-meal glucose responses when it replaces sugary drinks. How it works, brief mechanism. Rooibos contains flavonoids and aspalathin, compounds that have antioxidant properties and modest effects on glucose and lipid metabolism. Because it lacks caffeine, it won't add to jitteriness, insomnia, or urinary frequency the way caffeinated beverages can in sensitive individuals. Evidence notes. Small clinical trials and laboratory studies report improvements in markers like LDL oxidation and postprandial glucose in certain groups. These are encouraging findings, but not definitive cures. Think of Rooibos as a low-risk, supportive habit that may help metabolic health when combined with healthy diet and activity. How to prepare? Practical example. Use 1 Rooibos tea bag or 1 teaspoon of loose leaf per 8 to 10 ounces of water. Rooibos benefits from longer steeping. 6 to 10 minutes is a reasonable range. Because it's caffeine-free, you can drink it later in the day. Add a slice of orange or a cinnamon stick if you want sweetness, without added sugar. Timing relative to medications and meals. Rooibos can be taken at any time. If you have diabetes and are on glucose-lowering medications, monitor glucose after switching a sweetened morning beverage to Rooibos as part of a broader plan with your clinician. Rooibos itself is not known to cause dangerous drops in blood sugar, but removing high-sugar habits can change medication needs over time. Discuss any planned changes with your medical team. What to watch for? Rooibos is well tolerated by most people. If you notice unusual digestive upset after trying it, pause and discuss with your clinician. Rooibos is typically a safe daily choice for evening or daytime drinking. Tea to drink number 3. Peppermint, digestion, mild airway ease, and a clear-headed cup without caffeine. Why it helps? Peppermint, Mentha ex piperita, is an aromatic leaf tea that helps digestive motility, eases bloating, and provides a refreshing mental lift without caffeine. It can reduce cramping by relaxing gut-smooth muscle and produces a cooling menthol sensation that many seniors find soothing for mild congestion or sinus discomfort. How it works? Brief mechanism. Menthol, the active compound in peppermint, acts on transient receptor potential channels and smooth muscle to reduce spasm and improve the subjective feeling of bloating. It also has modest bronchodilatory effects through menthol's action on airway sensation, not a substitute for inhalers, but helpful for mild congestion or throat comfort. Evidence notes. Clinical trials show peppermint oil or tea can reduce symptoms of irritable bowel and dyspepsia in many adults. The evidence for respiratory benefit is more about symptom relief than treating disease. Use peppermint as a symptom-guided tea, helpful for digestion and mild airway congestion, but not a cure for infections or chronic lung disease. How to prepare? Practical example. Use 1–2 teaspoons of dried peppermint leaves or a single tea bag per 8 to 10 ounces of water. Pour boiling water over the leaves and steep for 7 to 10 minutes, covered to preserve volatile oils. Drink after a meal or when you need digestive relief. Peppermint is a great late morning or early afternoon cup. Timing relative to medications and meals. Avoid peppermint if you have significant gastroesophageal reflux disease, severe GERD, because peppermint can relax the lower esophageal sphincter and possibly worsen reflux for some people. If you're on antacid regimens or drugs for reflux, note your symptoms after introducing peppermint and discuss any change with your clinician. What to watch for? Increased heartburn or reflux symptoms, mouth or throat irritation, or a new sensitivity to mint. If reflux worsens, stop peppermint and try rooibos or nettle instead. Tea to drink number 4, ginger plus turmeric blend, an anti-inflammatory pair with better absorption when combined with black pepper. Why it helps? Ginger and turmeric are two classic roots whose active components, gingerol and curcumin, offer complementary anti-inflammatory and digestive benefits. For older adults, this combo can help joint comfort, reduce post-meal inflammation, and support digestive function. The combination tends to be better tolerated when brewed as a tea rather than taken as a high-dose extract. How it works, brief mechanism. Curcumin from turmeric and gingerol from fresh ginger reduce inflammatory signaling pathways at low to moderate doses. Curcumin's bioavailability is limited on its own, but a very small amount of black pepper, piperine, increases its absorption substantially. Brewing fresh roots extracts soluble components in a way your liver can handle more gradually than concentrated pills. Evidence notes. Randomized trials and systematic reviews suggest ginger reduces nausea and can aid osteoarthritis symptoms. Curcumin trials show modest benefits for pain and inflammatory markers when the compound is made more bioavailable. Much of the safety data comes from brewed forms and low to moderate supplemental doses. Concentrated extracts carry a different risk profile and have been associated with liver strain in case reports when used in very high amounts. How to prepare? Practical recipe. For a single infusion, slice 1–2 inches total of fresh ginger root and 1–2 1-inch fresh turmeric root, or 1–2 1 teaspoon each if using dried powdered forms. Simmer gently in 12 ounces of water for 7 to 10 minutes. Do not boil vigorously. Strain into a cup and add a pinch of black pepper, a small grind is enough, to improve curcumin absorption. Add a squeeze of lemon or a teaspoon of honey to taste if needed. A common, safe routine is 1 cup after lunch or early evening. Timing relative to medications and meals. Ginger and turmeric can be taken after meals to help digestion and reduce gastric upset. If you take anticoagulants, like warfarin or antiplatelet therapy, discuss turmeric with your clinician. Turmeric has mild anti-thrombotic effects and could contribute to bleeding risk in combination with blood thinners at higher supplemental doses. The brewed tea itself is usually low risk, but supplements with concentrated curcumin are a different category. What to watch for? New or increased bruising, unusual bleeding, e.g. nosebleeds, blood in urine or stool, or digestive upset. If you have gallbladder disease, ask your clinician about ginger use, as ginger can increase bile flow in some people. Practical substitutions and flavor ideas. If you miss the ritual of black tea, try rooibos spiced with cinnamon and an orange slice to replace the flavor and sweetness without sugar. If you like a morning warm-up with a caffeine jolt, choose a small, well-timed brewed black tea earlier in the morning rather than several mugs throughout the day, and try replacing your second cup with rooibos or nettle. For a calming evening routine, rooibos or chamomile, not detailed here, are better choices than caffeinated teas. Nduzhi, for sore throats or digestion after a heavier meal, peppermint or ginger turmeric can be your go-to single-cup fix. How to substitute safely, a stepwise plan you can try. You don't need to change everything overnight. Here's a simple sequence that lets you trial one habit at a time, with low risk and clear outcomes to watch for. 1. Pick the single cup you'll swap. Example, your 8 hours morning sweetened black tea. 2. Replace that 1 cup with a recommended alternative at the same time of day. Example, swap morning sweetened black tea for a ginger turmeric cup after breakfast or a rooibos mid-morning. 3. Keep everything else the same for 3 to 6 weeks while you observe the outcomes below. 4. Track 3 simple measures weekly: energy level, episodes of lightheadedness, unsteadiness, and digestive comfort. If you track blood pressure or blood glucose at home, note those values before and weekly after the swap. 5. If you notice improvements, you can add a second swapped cup after clinician approval. If you notice new problems, stop the new tea and consult your clinician. The 30-day 1-cup challenge, practical behavioral framing. This is a low-cost, low-risk trial that often yields helpful signals. The rules are simple. Replace 1 habitual tea with a recommended alternative for 30 consecutive days. Choose a single outcome to watch as your main metric. For example, fewer dizzy spells, better morning energy, or less bloating. Keep a short daily note. What you drank, how you slept, any dizziness after standing, and any digestive differences. At the end of 30 days, review the notes and discuss with your clinician if you want to continue or adjust medications, lab monitoring. What to measure and how to interpret change. Useful, simple measurements include symptoms, episodes of lightheadedness, dizziness on standing, falls or near falls, increased or reduced joint pain, changes in bowel regularity or reflux. Objective values you may already track: home blood pressure readings, sitting and standing, fasting glucose for people with diabetes, or weight and swelling for those monitoring fluid status. Laboratory markers you and your clinician might follow if you start a new herbal supplement: INR for those on warfarin, liver function tests if you're adding concentrated extracts, or electrolytes if you're making big changes to diuretic herbs. How long to wait for results? Expect some meaningful signals within 2 to 6 weeks. Energy, digestion, and dizziness often shift within that window. Chronic measures like bone density won't change quickly. Nutrient-related benefits accumulate over months, which is why sustaining a small habit is more powerful than a dramatic one-time change. Red flags that merit immediate medical attention. Stop the new tea and call your clinician if you experience sudden or persistent lightheadedness, fainting or near-fall events, yellowing of the skin or eyes, dark urine, or persistent nausea. These can be signs of liver strain, new or unexplained heavy bleeding, or severe bruising, especially if you're on blood thinners. A noticeable worsening in how a prescription medication affects you, for example, if a usual dose suddenly causes pronounced side effects. Practical notes on supplements and extracts. Why brewed teas differ. It's important to repeat this distinction. Brewed whole leaf or root teas and concentrated supplements behave differently in your body. A cup of brewed green tea contains a fraction of the catechins and EGCG found in a single high-dose extract capsule. Those concentrated doses have been implicated in liver injury in case reports. Brewed tea is generally lower risk. If you're considering a packaged supplement or detox blend, treat it like a medication. Talk with your clinician. Ask whether liver monitoring is indicated, and be cautious if you're on multiple drugs metabolized by the liver. Common questions you or a caregiver might have. Q. Can I mix nettle and rooibos? Yes. Most brewed teas mix fine. Keep the combined intake moderate, 1 to 2 cups total before checking for effects, and if you're taking blood thinners or diuretics, mention the mix to your clinician. Q. Is it safe to use turmeric supplements instead of brewing tea? Supplements can provide higher concentrated curcumin doses and therefore have a different safety profile. If you're considering supplements, bring the product label to your clinician for a discussion about dose and monitoring. Q. What about flavored or bottled teas? Many commercially prepared iced teas have added sugar and preservatives. Read labels for sugar content and prefer unsweetened or lightly flavored options. If a bottled product lists concentrated extracts or detox claims, approach it as you would a supplement. Q. Are herbal teas safe for people with dementia or memory loss? Herbal teas that are caffeine-free, rooibos, nettle, are often well tolerated. However, if the person in your care is on multiple medications, check for interactions. Also be mindful of fluid balance and toileting needs. Large volumes late in the day can increase nighttime trips to the bathroom and disrupt sleep. Bringing your clinician or pharmacist into the conversation. When you next see your clinician or pharmacist, bring a short list that includes the names of the teas or supplements you use, including brand names if relevant, the timing and usual amount, for example, 2 large mugs of strong black tea sweetened with sugar, 1 at breakfast and 1 mid-afternoon. Any symptom changes you've noticed, and any home blood pressure or glucose readings that surprised you. Ask targeted questions like, does nettle's vitamin K content matter for my warfarin? Is 1 cup of brewed green tea a day safe with my statin and metformin? Should I have liver testing if I start a turmeric supplement? Remember, this is not about stopping drugs. It's about making small beverage changes while keeping your medical team informed. Putting it together, a sample week of safer tea habits. Here's an example routine that follows the SWAP plan and keeps hydration, timing, and medication safety in mind. Monday morning, replace your usual sweetened black tea with rooibos spiced with cinnamon. Mid-morning if you normally have your tea with breakfast. Monday evening, peppermint after dinner to aid digestion. Tuesday lunchtime, ginger turmeric cup after lunch. Wednesday mid-afternoon, nettle after the meal to support minerals. Repeat and track symptoms for 4 weeks. If you're on blood thinners, pause nettle until you talk with your clinician. A final short vignette. Small change, meaningful result. A 70-year-old man I'll call Ms. J had recurring lightheadedness. He was on 2 blood pressure medications and liked a strong hibiscus iced tea daily. After a cautious discussion, he replaced his morning hibiscus with rooibos and shifted hibiscus to a rare treat rather than a daily habit. Over the following month, he reported fewer dizzy episodes and greater confidence getting up in the morning. He did not stop his blood pressure medications. He simply altered 1 daily habit and checked in with his clinician to monitor effects. Parting guidance and the practical next step. If this message landed with you, pick 1 small swap today. Replace your most suspect cup, often the sweetened black tea, the daily hibiscus, or a high-sugar bottled tea, with one of the 4 options above, and keep a short daily note for 30 days. Watch 3 outcomes. How steady you feel when you stand, your energy across the day, and your digestive comfort. If you're on medications, especially anticoagulants, antihypertensives, or multiple liver-metabolized drugs, let your clinician or pharmacist know before you make the switch. Final precautions to remember in 1 short list. Brewed tea concentrated extract. Supplements are different and often riskier. Don't stop or change prescription medicines without clinician guidance. Watch for dizziness, jaundice, new bleeding, or sudden changes in how meds affect you. These are reasons to call your clinician. If you're on warfarin, discuss nettle or any vitamin K-rich herbs with your care team. Space diuretic herbs away from bedtime to avoid nocturia and falls. Closing, encouragement and the CTA. You don't need to be perfect to protect your independence. Small, consistent changes compound over time. Try the 30-day 1-cup challenge. Replace one habitual cup with a safer choice. Track how you feel and bring your notes to your next clinic visit. Comment below which tea you'll stop and which one you'll try, and tell me where you're watching from. I read a lot of comments and reply when I can. Be kind to your body. Listen to what it's telling you. It's never too late to support it better.